My persuasive speech is about the topic of COVID 19, more commonly known by the public as coronavirus. According to the Center for Disease and Control, or commonly known as the CDC, the cases of COVID 19 are rising and deaths are increasing throughout the United States of America. The CDC warns that all Americans and citizens of all countries must remain vigilant. Sadly, people are required to make daily changes in their lives and their daily routines. These are challenging times, and it is extremely tough to stay disciplined to mask wearing and social distancing. These drastic changes are more important now than ever before. Experts warn the worst is still ahead of us in the coming months, and the choices that people make now will impact the future. The CDC is issuing warnings to stop the spread of coronavirus. If people are more vigilant and take better precautions with their families, they can prevent the spread of COVID 19, and people will be much safer in the long run. Anybody can have symptoms of COVID 19 or coronavirus. These symptoms can range from mild to severe. Typically, the older adult population and folks that possess underlying health medical conditions are at a much higher risk for contracting coronavirus. Conditions including heart disease, lung disease, diabetes seemingly increase people's chances of contracting the virus or coronavirus. People with underlying conditions can develop and expose those in the surrounding areas. Folks that are confirmed positive for COVID 19 have a very diverse range of symptoms. These symptoms can appear between 2 to 14 days after roughly being exposed to the virus. People may experience chills, fever, cough, shortness of breath or difficulty breathing, fatigue, muscle and body aches, headaches, a new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, and diarrhea. There could be more symptoms that are yet to be discovered and announced. People should seek emergency care. These signs include trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake up or to stay awake, and lips that appear as blue. The CDC recommends contacting a professional doctor or physician for any symptoms that aren't present on the list. Not all of the symptoms will appear on the list. Contact 911 or any other medical emergency responders if you or someone you know may have contracted coronavirus, and be sure to notify the operator with all details possible. Many folks are unaware of the differences between the influenza, or more commonly known as the flu, and COVID 19. The influenza flu has been around for quite some time. Both the flu and coronavirus are different viruses. Both are very contagious, illnesses that attack the respiratory system. COVID 19 is caused by infection with a very novel coronavirus named SARS-CoV-2, and the flu is caused by infection with other influenza-type viruses. Indeed, there are some differences between the influenza flu and COVID 19. It seems that coronavirus is more likely and easier to spread than the flu. The novel coronavirus, which causes more detrimental effects on its victims. With COVID 19, it can take longer for symptoms to appear for folks. People can be contagious longer too. Another fact to consider is that there are several vaccines available to protect against the virus. But the best way for an individual to avoid contracting the virus is to avoid being exposed to the virus itself in the first place. Many folks have a difficult time determining whether they have the flu or coronavirus based on some symptoms. Get tested and determine if you are positive or negative for the virus. To protect yourself and those around you better, the CDC recommends wearing a face mask, using tissues and hand sanitizer with at least 60% alcohol if it is available. If someone is to engage in public activities, they should practice safety precautions. Many folks stress about how the previous presidential administration recently handled the pandemic. Anxiety and fear about a new disease and what could potentially happen can be overwhelming for people. It can cause intense emotions for people of all ages, such as teens, children, young adults, and the elderly. Social distancing can make folks feel lonely and isolated throughout the chaos. Isolation can cause stress to increase for folks and even anxiety as well. In the long run, however, these actions are necessary to reduce the spread of coronavirus. Folks should cope with stress and other negative emotions in a positive manner. People can uplift each other, whether if they know each other formally or informally. It can grow the community and bring others together metaphorically. Some stress factors that can occur are fear, worrying about your health and others' health. People worrying such as about their loved ones and friends as well. They tend to worry about their financial situation or loved ones too. They also experience a loss of support. People should change their sleeping and eating patterns. Otherwise, they can have difficulty sleeping or concentrating, worsening chronic health problems, medical conditions, increased use of tobacco and alcoholic abuse substances. Everyone should take care of each other's mental and physical health. In conclusion, folks should wear masks regardless of someone's political affiliation. People should respect each other and their lives. Together we can overcome this challenge. Thank you.